Hi,
Hi.
here we are. Dr. Bendickson of Kindbody. Okay, we're going to talk a lot about eggs today.
Amazing.
Why don't we start? Why don't you just give us your little intro and can you tell us about Kindbody and what makes it different maybe than some other fertility clinics?
Sure. My name's Kristen Bendickson, and I'm a fertility specialist. And what that means is that I was originally an OBGYN, so I did training for 4 years for that after med school, and then I decided to do more training so that I could provide the care that I'm providing to my patients today. And so that's a 3-year fellowship. So I did all of that at Harvard and Cornell. On the East Coast, I came out to California. I worked at USC for 15 years, where I led their program there. I led the fellowship training program there, so trained a lot of the other fertility specialists. Some of them are here today, actually. And then 4 years ago, I moved over to Kindbody because I had been watching Kindbody. It started in 2019 as a small little mobile van in New York City that was providing fertility testing to patients. And from that origin in 2019, we have grown, and now we have 27 clinics all over the country.
It's amazing.
It is
Congrats on
amazing.
that.
Yeah.
So why do you think, clearly you're meeting a demand, so why is there such a demand and need for so many Kindbody clinics?
So I think if you think about fertility in general, women and couples are waiting longer to have their children. And I think that is a direct link to women in the workforce and having careers that they want to focus on and want to spend some time focusing on those careers without having the two hats of being a working mom. And so because of that, and I think the awareness that there are fertility treatments that they can maybe, if it's not working so well on their own, that they can maybe rely on those treatments to help them have their children later.
Do you think there's more, well, I think we both think there's more of a push for people to preserve their fertility because many of us are talking about it more, which is awesome, especially Kindbody. Why else do you think women are preserving fertility more? Do you think this is going to have like a long-term lasting impact on the way we go about bearing children?
I think that there are several reasons why we talk about it more. I've been doing this for a very long time, and so I probably started 20 years ago, and I would say 20 years ago, when my patients were freezing their eggs, they were all in their 40s. Early 40s, because they're the ones that maybe had worked for a long time, had actually had the money to do it, because it can be expensive, and people weren't talking about it. People weren't even talking 15, 20 years ago. People weren't even talking about IVF, and now it's so in the mainstream to talk about fertility. You hear all the time celebrities talking about their infertility journeys, talking about their treatment, about freezing eggs and freezing embryos, and so it is constantly in the social media sphere, and so people, I think, are very aware of it. And they've had, again, infertility is so common. 1 in 6 couples have infertility. And so we look at all of these women that are at this conference. There are women at this conference that have struggled with infertility, struggled with recurrent pregnancy loss. And so because there are so many more ways that as women we can connect and talk, people talk about these things. And so I think that is one. I think that because employers are now starting to offer fertility services as a benefit, and that is something that they are very purposeful in doing because it gets them to get employees. I have lots of patients that say to me, they come and they say, it's really expensive. I'm trying to find a job where my employer will cover it. And that's one of the things that we do at Kindbody that's very unique, is we are not only providing the fertility care, but we are also providing the benefits. So we are the kind of also the benefit provider through a myriad of employers. We have over 150 employers that we do their fertility service for them.
So that means an employer could find you, bring you
Correct.
in to cover the benefits, and then you would also provide the service for the patient.
Exactly. And so we have really large companies like SpaceX and Lockheed Martin, and we have very niche companies like Goop and Skims, where their employees can directly get those access that treatment. And the wonderful thing about how we provide the care is that the people, they have access to a certain amount of benefits, and they can utilize it in any way they want. We
That's
don't
huge.
put, so we don't put any restrictions or regulations on what they want to do. So if they want to use all of their benefit to freeze eggs, and they want to freeze their eggs 4 times, and that's what their benefit through their employer covers, they can do that. It's up to them.
I just want to emphasize how important that is, because as somebody who went through infertility, I had no coverage, but if I was able to buy coverage, it would be from somebody that was like, you know, a 60-year-old man in a room who runs an insurance company who'd be like, I think you need to do 3 versions of this before you can move on to IVF. And it's like, why are those the people making the decisions for us about what we need? So I think what's great about Kindbody is you get the funds, and then you can decide how you want to use them. And I hope that's the wave of the future.
I do too. Unfortunately, most insurances are very difficult to manage. They require a lot of testing and excess testing that, as a fertility specialist, I don't need for my patients, but they require my patients to have that in order to go through the next step. And it's a one step at a time, as you probably went through. You have to get the testing, and then they apply for your prior authorization. Then it takes 4 weeks to get the prior authorization. Then you can go through the treatment, and then you've gone through the IVF, and maybe you want to have a second baby, so you want to go through 2 rounds of IVF and create more embryos. They won't let you do that. They force you to use the embryos that you have, and they don't help with embryo making. So there's lots of restrictions. I think the good news in California is that a law was passed to provide IVF coverage, but we don't know what the specifics of that law are. And there are already signs that it's going to be of companies of certain sizes, and it's not going to necessarily be fertility preservation. So it probably will not cover egg freezing.
Right, and maybe an example of where it would is if somebody is a cancer survivor and they need to do preservation, but otherwise you would not necessarily be covered to freeze your eggs, whereas if you were going through Kindbody or working with somebody who had Kindbody insurance, in that choice of how to use it, you could do preservation for the heck of preservation.
Yes.
Is that right?
Yeah.
Okay.
Absolutely.
When do you think is the right time for women to think about their fertility? I think
now.
Yeah, exactly. I was like,
yesterday.
My daughter's 6, and I'm debating if it'll be her 16th, 21st, 25th birthday we freeze her eggs. But like, when is the best time for women to think about it? And truly, is there a golden age to freeze eggs?
Yes, I'm the same way. I have a 16-year-old daughter, and I'm always talking to her. I'm like, well, just remember, when you graduate from college, we're going to freeze your eggs. Yeah. You'll do that early. It is never too early to contemplate and to start thinking about what your potential family might be or what you want it to potentially be. And it's never too early to start learning and listening and hearing and understanding the restrictions that, unfortunately, as women, our age puts on that, and how those limitations could eventually affect your dreams in a negative way. And so I think it's important to think about, maybe you don't want kids, but maybe there's a glimmer of you inside that is like, maybe. I have a lot of patients that freeze eggs that tell me, they come in very specifically saying, I don't want children, but maybe. And I just want to preserve that option.
Option is everything.
Options are everything. And then I have patients that say, I want to have 4 kids. So you have to think about, what does that vision look like for you? You're running on the beach, and how many kids are you chasing after? Do you want 4? And some people, that's their comfort zone, and other people just want 1. And so you have to also think about, well, when is it that I want to start that family? Because if you want 4 children, you shouldn't be starting at 40 because pregnancy takes almost a year, right? It takes almost a year to make a baby. And then it takes another year really before you should get pregnant, because there is good data to suggest if there's a longer interval between when you have your baby and you get pregnant, there are some benefits to waiting, and you'll have a healthier pregnancy. So I always say, think about it as there's a 2-year interval. And so think about if you want 4 kids and you're 36, that means 36, 38, 40, 42.
In best case scenario. If it
Best
works
case
in
best
perfect
case
timing.
scenario, if everything works out perfectly, and oftentimes the older you get, it just gets harder. It gets harder to get pregnant as we get older. Women are more likely to miscarry as they get older, and they're more likely to have genetic issues in the pregnancy itself. And all of those things can just make it harder to get to the baby and prolong things. So you're absolutely right. So it may not even be that perfect 2-year interval. And so you really need to think about what that timing looks like for you, and then learn about options. And egg freezing and embryo freezing they're not for everybody. But if you learn about what the potential issues are with age and learn about what your options are with fertility preservation, then you can make an educated decision about what is right for you in this moment. And I always say in this moment, because your moment and how you feel about egg freezing right now may be very different than how you feel about egg freezing in 2 years from now. So kind of, I always say, just keep your options open.
Yes. Having the choice is what's so empowering about the fertility process. Often we hit it when we have no choices left and it's the last case scenario. Have you seen any rise? You might be like, girl, you crazy. Have you seen any rise in sperm preservation? Because I have heard that on first dates sometimes now, people are talking about whether they have frozen both eggs and sperm. Literally heard
Not
that.
so much.
Okay.
I mean, whispers of it.
Because it's not true that sperm can go forever, right? It's a myth.
It's not entirely true.
Yeah.
I mean, for the most part, men have unlimited supplies of sperm.
Sure.
And also, for the most part, you can generalize it, that sperm are created in the testicle, and then they come out and they ejaculate. These are my terms that I use all the
Yes,
time in work.
thank
I mean,
you.
you guys are probably already not so familiar with them, but it takes 2 months. So I always tell a guy, you could be 45 years old, your sperm's 2 months old, and your sperm's going to come to the table ready, great genetics, not a problem. Eggs are totally different. So eggs are put in a woman's body before they're born. There are a limited number of eggs. When those eggs are gone, that's when women go through menopause. And then unfortunately, because the eggs were put in our bodies before we were born, they're also aging. I think the easiest way to think about it is that each month, a woman releases an egg, and that's the egg that you potentially can get pregnant from. And the little mechanical parts inside of that egg that are controlling the development of the egg, because the egg literally is going through its final stages of development as it's getting released from the ovary, those little mechanical parts, they don't function as well when we're older. It's just like any mechanical part in a car, a computer. If you took a car and you put it in front of your house and 10 years later you tried to turn that car on, sometimes the engine's going to turn over and sometimes it won't. So it's the same thing with our eggs, right? Sometimes those mechanical parts are going to function just fine, and that's why women, when they're older, can get pregnant. You can get pregnant at 42 naturally, right? It's just harder because in every opportunity for you to get pregnant, which is only once a month, you only get 12 shots, right? If you're having like really regular periods, you only have 12 shots in 1 year. That egg, the older we get, is just more likely that the development's not going to go smoothly and something's going to happen and you're just not going to get pregnant or you might miscarry.
And back to the golden moment to freeze. Is 25 too young to freeze?
No.
Okay. So you can do it really as early as you feel comfortable emotionally?
I think as early as you feel comfortable emotionally, and also you have to think about the trajectory of your life and what you want out of your life for yourself, and maybe that's your career, and let's just take an example. Someone who's 24, you would normally say to them, you can definitely wait 3 years, because the difference between 24 and 27 for most women, they're not going to get a different number of eggs. Those eggs aren't going to be worse at 27 than at 24, but maybe the trajectory of your life is that you're going to go travel because you work for an NGO and you want to go out of the United States and you're going to be traveling for the next 6 years. We'll do it now, right? And once those eggs are frozen, the egg doesn't change. Just like if an embryo is frozen, that embryo doesn't change, right? And so its ability to become a pregnancy is the same, whether you thaw that egg out in 2 years or 10 years or 15 years. I've had many patients that froze eggs actually in their early 40s, have come back when they're 50, 51, thawed those eggs out and got pregnant. And that's because their uterus doesn't change either, for the most part. All the way up until about 51, 52, we start seeing some complications in pregnancy, which are more related to like high blood pressure and other things like that, not actually the baby. So if you have eggs that are young and healthy from when you're 32, you could be 42 and get pregnant, and your chances of getting pregnant are of your 32-year-old self.
Amazing. Is there any impact between birth control and fertility later on?
In fact, there's actually only a positive benefit. So
Great.
there's no negative benefit. I have a lot of patients that are on birth control pills and then they get off because they're just like, oh, I don't know, I just feel like maybe it's doing something to my fertility in a negative way. They assume it's negative. And in fact, actually, it's not. I think you have to be mindful of when you stop any hormonal birth control, whether it be an IUD with progesterone or birth control pills, that it can sometimes take a few months to get your periods back, and you can't get pregnant until you have like a normal cycle. So there might be a little bit of a lag. So you have to think ahead. Birth control and any hormonal birth control is actually very effective for treating a disease called endometriosis. And endometriosis is very common. We think maybe 1 in 10 women have endometriosis. And endometriosis can negatively impact your fertility in a major way. And so if you are taking birth control for 15 years and you have endometriosis, but you don't know it, you are actually doing yourself a huge favor by being on hormonal contraception.
I love that. We're going to move to a quick Q&A if anybody has any, and then I want you to tell everybody where they can find you if they need a consult or on social media. Did anybody have any questions?
So a lot of kind of lifestyle factors that we think that may impact egg quality and also for men sperm quality. Some of them are long-term life things like smoking. Smoking is, I always say, nicotine is egg killer. Like, just don't. But there are other things like, in general, just having a good, healthy diet, supplements, making sure that like when you are eating that the fruits and vegetables don't have pesticides. So that could be organic or just washing your fruits and vegetables really well. So getting BPA out of your life. So using glass containers for food and not microwaving them. So all of those little things they're important, but they're so small compared to just the huge impact of age. So they can't overcome age, and we can't stop age.
But you can take good care of your eggs.
Absolutely,
and your sperm.
Absolutely.
Are you a fan of It Starts With the Egg, the book? Do you know that
Yes,
book?
I have a lot of patients that read that. I'm a big believer in supplements. I think there are certain supplements that we have much better data about that can help both egg and sperm quality. And there are a lot of supplements that we know a little bit about, but that doesn't mean that supplement could be just as good as something called CoQ10, where there is a fair amount of data. Just because there's only a small amount of data doesn't mean it's not powerful. So I actually have a very long list of supplements that I give to my patients because I want to make sure that everyone has agency in their process. And for infertility, it's a very powerless process. And I think people want to be able to do something and take part and kind of in that journey and path forward.
I think that's a perfect spot to end unless anybody has any other questions. Where can everybody find you?
They can find me. Well, so first of all, we have a Kindbody booth over there. So if anyone
Beautiful yellow
wants my
tablecloth.
card, it literally also has my cell phone on it. You can text me anytime. It's right over there. But I'm also on Instagram at Dr. Kristen Bendickson, and you
Amazing.
can find me there.
Thank you. Thank you, guys.